The June 25th, 2018 meeting of the Agenda Charter Committee will now come to order. Will the clerk please call the roll?
Mrs. Conley? Here. Mr. Delahanty?
Here.
Mr. Moyo?
Here.
Chairwoman Taylor?
Here.
Mr. Wilcox?
Here.
Is there anyone signed up for public forum?
Yes, there is. When I call your name, please come forward to the podium. You'll have 2 minutes in which to address the committee. Please conclude when the timer sounds. Thank you. Our first 3 speakers are Lexi Popovich, Janine Sanger, and Caitlin O'Brien.
My grandmother and grandfather died from smoking-related diseases. I watched my grandmother continue to inhale cigarettes as she was battling and ultimately died from throat and lung cancer. I watched my mom, who is not a smoker, battle cancer this past year, and most recently my friend's mother receive a terminal diagnosis with lung cancer. I have been impacted from the detriment of cancer, the damage it does to families and friends, and the crippling effects smoking and tobacco have on the human body and mind. I stand before you today for personal reasons, moral reasons, and professional reasons. I made a promise to myself years ago that I would always stay true to living a life for the betterment of others and pursuing a career that improves the livelihoods of others. Our health is the most important thing we have, is the reason we are standing here today, breathing, walking, and talking. Today, I am thankful for my health and my ability to have a voice for all those lung cancer patients who do not, and today I will also have a voice for the youth in our county who are becoming nicotine addicted. Adolescent exposure to tobacco and nicotine often primes the brain or pathways toward addiction to other substances. With the opioid epidemic in full swing, we must be aware of the dangers that any substance, including nicotine, has on the young developing brains and the impacts for future addiction to any substance, especially in our community. E-cigarettes were designed as a cessation device for those trying to quit combustible cigarettes. Although as a public health advocate, I recognize it is not a proven or effective cessation device, I also recognize that around our community, youth under 18 who do use e-cigarettes are those who have never used cigarettes or tobacco. The CDC states that e-cigarettes are not safe for youth, young adults, or any adults who do not currently use tobacco products. Our recent risk behavior survey showed that 5% of all high schoolers in the county smoke cigarettes and 20% are using e-cigarettes. Therefore, our middle and high school students are actually using these devices as a gateway into the world of tobacco and nicotine addiction. Having the opportunity, responsibility, and honor of protecting youth in our community, you have the potential and the option to save one child or one teenager from lifelong addiction, a battle with cancer, or potentially leaving their future children or grandchildren robbed short of many years together. What would you do? Thank you.
Good evening. The Webster Health and Education Network, a drug-free community coalition, is comprised of healthcare professionals, educators, law enforcement, parents, community members, and chemical abuse specialists who are working to promote healthy, substance-free behaviors in the Webster community. The coalition's goals include reducing early drug and alcohol exposure, promoting community awareness regarding risk, and decreasing rates of high-risk behaviors. When members, after much data review, research, and consideration of the current tide of addiction and overdose, chose to focus on the reduction of nicotine and alcohol use in our youth, we are specifically focusing on the use of vapes, e-cigs, and Juuls as nicotine delivery devices. I think you will agree that rarely, if ever, does a heroin user begin his or her drug use with shooting up heroin. Nor does one who is addicted to cocaine start their drug use with snorting a line. Although the use of nicotine seems rather benign in comparison to other drugs, it is important to note this. Use of vape devices mimics drug taking or substance using behavior. Aside from exposing youth to nicotine and other harmful chemicals, use of these devices essentially trains our youth to seek substances as recreational and coping activities. According to the CDC, teen smokers are 3 times more likely to use alcohol, 8 times more likely to use marijuana, and 22 times more likely to use cocaine. In addition, many parents and adults are unaware that these devices can be altered and other substances such as liquid THC can be inserted, allowing our youth to covertly vape the ingredient that is active in marijuana. We need to embrace this opportunity to put measures in place to deter youth from securing these devices. Please strongly consider moving this legislation forward. Thank you for your time and careful consideration.
Hi, my name is Caitlin O'Brien. I'm the Government Relations Director for the American Heart Association. And whenever I talk about Tobacco 21, I kind of just like to start off by reminding everyone that tobacco use still remains the leading preventable cause of heart disease and stroke, which is the nation's #1 and #5 causes of mortality. And you know, I want to be clear about a couple of things about Tobacco 21. The first is that we are not looking to ban e-cigarettes or vaping devices or Juuls, right? You know, if an adult is able to use them to help themselves stop smoking, that's great. But that's not what we're seeing with the rate of use amongst the youth. Kids, 13-year-olds, 14-year-olds, and 15-year-olds are getting these products, and these are the first tobacco products that they are using. And as you've heard before, they are transitioning from these products to your typical combustible cigarettes. So that's the first thing. The second thing is these Juuls, they have little pods in them. They often come in flavors like Swedish fish and creme brulee and chocolate, which are obviously meant to entice the younger users, right? As we know, the tobacco industries, they've made it very clear that they are looking for replacement smokers. And they found them, unfortunately, in our youth. So these pods that go into these Juuls and these tobacco nicotine delivery devices contain the same amount, if not more, nicotine than a pack of cigarettes. And they are equivalent to that in puffs that you take on it too. So don't be fooled just because they come in these types of flavors. And unfortunately, the social stigma has not attached to these products like it has with cigarettes. They are incredibly dangerous, and they do lead to heart disease, to stroke, to cancer. You name it, they are that deadly. And I want to touch on a couple other things too in terms of what makes Tobacco 21 so effective. We know it's effective because, like I said, it stops kids from ever picking up their first tobacco product, regardless of what it is. And it does that by eliminating the social source. We all know that kids get these products from their older friends, from their older families, right? A 13-year-old, a 14-year-old, a 15-year-old is far more likely to know and to hang out with and to come in contact with an 18-year-old than they are a 21-year-old. By raising the age, you can delay the initiation of these products with these kids and ultimately prevent a deadly tobacco addiction. We know that if a person can make it to the age of 21 without smoking, the chance of them ever starting drops to only 2%, and really quick, 96% of smokers say they started before the age of 21. So if that's not enough proof, then I don't know what is. So thank you, I appreciate it, and I urge you to vote yes on Tobacco 21.
Our next three speakers are Dorothy Petrie, Dick Hastings, and Annalisa Rogers. Thank you.
Good afternoon. Thanks for the opportunity to speak today. I know you've been inundated, especially the committee members, on a lot of statistics on the dangers of tobacco and nicotine usage and how these products, the use of these products, set young people up for a lifetime of both acute and chronic illnesses. This isn't just about lung cancer when somebody turns 70. This is about asthma. This is about other illnesses that affect young kids, tweens and teens. Before you this evening is a proposal that specifically targets prevention. I would ask all of you, you would know better than I do, how often a piece of legislation, how often a proposal comes before you that actually is about prevention and has the potential to make a positive impact on the health and well-being of thousands of kids in Monroe County. T21 works. No one believes that we are going to eliminate these products completely, but you should do everything in your power to decrease the access of these products to tweens and teens. As the speaker before me said, kids who are 13, 14, 15, they don't run in the same social circles as kids who are 21 and older. Decreasing access to these products mean fewer kids start using them. I have a 14-year-old son. He's at Schrader High School. Over dinner Saturday evening, we had a pretty cynical discussion on vaping and why kids do it. Why, when traditional tobacco use among young people is down, why is nicotine and vaping up? And our answers, there's no negative stigma for the usage of these products. It's not smoking, it's juuling or vaping. Kids don't cough or get sick when they use it for the first time. What happens when they use it? It's pleasant tasting. They have a positive drug-taking experience. It's positive. There's no negative. They don't smell. Their parents don't smell it on them. This is an insidious introduction to substance use. Waiting for New York State to catch up with the statewide legislation is relinquishing our responsibility to kids that are in our jurisdiction. You need to approve Tobacco 21 today, prevent substance abuse, and start protecting the lives of young people. Thank you.
Hi, folks. My name is Dick Hastings. I've been involved in CPAC out in the Fairport Pemberton area for over 20 years. Been the treasurer for 18. And I have all the youth risk behavior data that we track. Okay? It's very good. In terms of our issues in terms of smoking, we've gone from 39% in 1995 to 5% today, we're seeing. However, when you take a look at the e-cig and related kinds of things, it's just the opposite. It's going out of sight. And it's my understanding that that's what's happening in all communities. And when you take a look at how old were you when you started with this, 35% are 16 or under. That's a big number, big start. Yeah. So I'm 100% supportive of this. I think it's great that you're looking at this. I have a few other things I'd like you to take a look at in terms of high-risk behavior stuff and in terms of some of the drug things. And there's one thing I have to mention because I felt so impressed by it. I went to a session last May out in Webster, okay? And it was titled the Opioid Panel Discussion, but it got into a whole lot of more stuff than opioids. And I have some videos from it. If anybody wants one, it's yours, okay? And it was outstanding. They have done such great work out there. I'm just so pleased, and I thank my old work buddy, George Hebert, for what he did bringing that together. Anyway, congratulations. Good work. Pass it, please. Thank you.
Good afternoon. My name is Annalisa Rogers. I am the director of the Smoking Health Action Coalition. We are a program of the American Lung Association. I know that many of you have heard me say before that I started smoking at a really young age, and I did. And the impact is still with me. While I work for the American Lung Association, I can say firsthand that even though that I am a quitter, that smoking still is something that I still crave. It's not something that I'm proud of. It's not something that I would like to share with people typically, but the truth of the matter is that I still crave tobacco products, even now, having not smoked for many years. But the impact to youth is significant. Most of the people that started smoking at age 10, or 90% of youth started smoking before the age of 18, and then 96% before. Now, the funny thing about youth smokers is if you've actually started smoking at that age of initiation, which is about 13 years old, then you may not qualify for NRTs, which are nicotine replacement therapies. And that's because nicotine replacement therapies are not recommended for anyone under the age of 18. So that leaves at least a 5-year time span for kids of the 13 age category and to the point where they become extremely addicted to a tobacco or a nicotine product. Why should we allow that? 13 to 18 is a long period of time to continue to be able to have access to this product and not get help. So one of the things that we absolutely should look at is how to limit access. And it is very apparent that limiting access can go a long way in limiting youth use. Thank you.
Our next three speakers are Julie Hart, Nick Stomp, and Andrew Osborne.
Hi, everyone. My name is Julie Hart. I'm the Government Relations Director for the American Cancer Society Cancer Action Network. Thank you for the opportunity to be here today to talk to you about Tobacco 21. We are very, very supportive of this policy. And as somebody had mentioned earlier, I think there's this misconception that we've won the war on tobacco. And lots of us have stories about, oh, do you remember the days where, you could smoke on airplanes, when you could smoke in restaurants, when you could smoke in school. And, I have one of those stories myself. My mom smoked in the delivery room. It was with my brother, though, so I turned out fine. But we've come a long way in our tobacco control battle, but we haven't won the war on tobacco. And certainly the industry is very sneaky, very stealthy. And this next generation, certainly they're being targeted with different products, but that doesn't mean we should not protect them from those products. So what we've seen happen in New York State, there are 23 different localities that have adopted Tobacco 21 policies. So about 75% of state residents actually live in those areas. So we know Tobacco 21 has been implemented. There haven't been any glitches in those areas that have implemented this. And in terms of, arguments that you might hear, some of the things that we've heard at these other localities is, we should make an exemption for the military. Proud to say that all of those 23 localities, there aren't any military exemptions in those. In addition, there's about 300 local policies nationwide, and also very proud to say there aren't any exemptions for the military in any of those local policies, primarily because the military isn't looking for an exemption. The military traditionally has been targeted by the tobacco industry, and if anything, they themselves have acknowledged that tobacco use impacts military readiness. Another argument that you might hear is, all right, well, what about, retailers are very responsible, and we state that also. Retailers are very responsible. Kids get their tobacco products from social sources. So my kids are 19 and 20. My son, who turned 19, fruit, all right. Well, anyways, you're going to all see me by email, okay? So we very, very supportive, and we hope you vote yes on this. Thank you.
Hello, my name is Nicholas Stumpf. I'm representing the Joint Smoke Shop located in Hilton, as well as Dewey Avenue Smoke Shop here in the city of Rochester. I'm actually here tonight to voice against the bill, one of the few. This country seems to change more and more every year, and our freedoms are becoming more and more entirely age-restricted. I think that sometimes we forget what actually brought George Eastman to this city and what paid for this country, because we didn't have a currency, and also what paid France for their protection during the Revolutionary War, which was with trade of tobacco. I think we also forget that men and women at the age of 18 years old are now considered an adult, and they can serve their country, which I did in 2006. After graduating high school, I was able to enlist. But now that young man or woman can't go to a bar and have a beer because that freedom was ripped away with their father. But they can now have a victory cigar unless you change this bill. You could be on the side of the road in Afghanistan or in Iraq, just hit by a roadside bomb, or just surviving an ambush in the Korengal Valley. But he can't calm his nerve with a smoke. Or even returning from his second tour overseas, he won't be allowed to have a cigar with his father because he won't be at the age of 21. The media likes to point out the opiate addiction and how it's increased by smoking of cigarettes. Well, how many of those same opiate-addicted Americans ate McDonald's once or twice a week? How many of those same opiate-addicted Americans drink Starbucks coffee or is addicted to playing video games late nights and day, as it does with our modern teens? I'd say probably 8 out of every 10 young teens falls into one of those categories. I would say that also those same opiate-addicted people, Americans, were also led into addiction from their doctors, paid by New York State Medicaid. And those same people are improperly managed and improperly detoxed off of those same drugs, which puts them into opiate addiction, not tobacco. This past Saturday at my shop in Hilton, a young man came in and said, "I'm graduating today and I want to get a cigar for me and a couple of my buddies." Very cool. It's an American tradition. Well, after speaking with him for a few moments and teaching him how to cut and smoke his first cigar, he had told me he was joining the Marines in 2 weeks. This may have been the last time I ever see this young man. It may be the first and last cigar or tobacco product the young man may ever purchase or consume, because he might not live to return home again. You know, it's not about changing the age. I think I'm hearing a lot of under 18 years of age is the problem. I think that's more of a control in your home and keeping an eye on your children. 18 years old, he should be allowed to purchase a tobacco product, not because he might sell it to somebody that's younger. That's his right at 18, not the 13-year-olds. Thank you.
I'm also here in opposition to this bill, and I have a packet full of useful information and statistics that come from real medical journals, doctors, professors. What I'm asking you today, if we're going to pass a bill like this in the name of our children, please check on some of this information that you've been given today. If you need more information from me, I'm happy to give it to you. One of the biggest fallacies I've heard today is that the use of electronic cigarette products is on the rise with our youth. That is completely false. Based on the CDC data, that number has dropped significantly from 2014 to 2016, showing that the initial boom of e-cigarettes was simply based on the fact that it didn't exist. So saying that this exponential growth was so large in the early periods of this product is like saying the use of finger spinners is up 100 million% since 2000 when they didn't exist. Now that the numbers have leveled, it's showing that those numbers are decreasing, normalizing, if you will. But the real issue here is that we've heard multiple times, we start smoking at 13. We start smoking way before 18. Why 21? Has anyone shown any evidence that raising the age to 21 is leading to less youth smokers? Because I'm here to present the complete opposite. And I have some quotes, which I don't have enough time to read, but I'd like to just leave you with one important one from the University of Buffalo regarding the gateway to smoking from vaping. This is from our professor of drug and alcohol abuse, Lynn Kozlowski. The national trends in vaping and cigarette smoking do not support the argument that vaping is leading to smoking. In fact, it's the opposite. Vaping is a harm reduction tool that smokers can use to save their own life. I started smoking at 13. I'm not proud of it. But when a customer comes into my shop, my vape shop, at 18, on their birthday sometimes, they're not happy because they can finally buy a tobacco product. They're happy because they can finally quit smoking. They know that this works. The data shows it. Vaping is 95% less harmful than smoking cigarettes, and all we are going to do is extend the period that our children have to wait until they can legally smoke. Everyone who smokes, myself included, start smoking because we are addicted to the nicotine, but then we die because the smoke kills us. And vapor gives smokers an opportunity to live a life, unlike my mother who died at 53 from smoking. So I'm asking you to consider the sources of this information, and please take a look at this pamphlet that I'm providing with you today. There are links to very good information that debunks a lot of the nonsense that we've heard here today. Thank you very much.
Our last speakers are Victor Canestraro and Raymond Troutman.
Hi, I'm Ray Troutman. This is my 5th day out of the hospital. I've been in the hospital and I have ulcerative colitis, which nobody realizes is also tied to smoking. When you can't have nicotine, it takes it out of your system and it harms you. They don't let you smoke because they've restricted laws where you can't have a cigarette in a hospital anymore. When I have nicotine, it takes the pain away. Right now, every one of you stand here and imagine getting hit as hard as you can in the stomach and throwing up. I went through it for 7 days. I came here today to tell you, do not pass these laws. All it does is harm people. Look at what it does to people with IBS. It's a painful disease. People have it. The doctors know it. But they've written laws that are making it hard on these people to be able to get this nicotine when you do need it. Yes, I started as a young smoker. In '95, I quit smoking. In '95, I had my intestines removed. I have had 5 surgeries. 5 times I quit smoking. This last trip to the hospital, I come home in pain, had 2 cigarettes, and my pain was gone. They've restricted the laws in this state so bad where they're mixing the laws with health care. We need to keep our laws out of our health care system. Leave it alone. Let them smoke at 21. Each one has an individual choice. I would be ashamed to see this body pass a law that takes away from an 18 years old's privileges. That's what you turn 18 years old to be able to make a choice. Thank you. And at the same time, well, I'm telling you, just imagine being kicked in the stomach as hard as you can and not be able to breathe. That's what I've been through for the last 5 days. I came here in a wheelchair, and I didn't care. I want you to know how painful this is. When you pass this law, you restrict people. If you decide to pass it, take it away from people with IBS. Let them have any rules they need to get well, because it's what's there that addiction's there. It's the same addiction that they're causing by opium when they take it away from them with the drugs. Thank you.
Hello, my name is Victor Canistero, and I'm the Executive Director of the nonprofit Coalition for a Tobacco-Free America. After surviving both of my brothers and my father to cancer from cigarette usage, I started the Coalition. Our goal was to get people off of tobacco products or to switch to safer alternatives. I have been smoke-free for over a decade by switching to e-cigarettes, and at the ripe age of 44, I've received my first perfect bill of health from my physician. I had attempted to quit smoking after starting at the insane age of 9. Every year since I was 21 years old. I'd quit every year, sometimes for a week, sometimes for a year, only to go back to smoking every time. It wasn't until I tried an e-cigarette that I was able to finally quit lighting up. Unfortunately, vapor products are now somehow fallen under the guise of tobacco regulation, even though research has shown it's between 95 and 99% safer. And I did bring you documentation as well. There are multiple studies, scientific, that show that vaping is not like smoking. And I'm going to go off the chart here, but if I put a couple of little grills in this room right here and we close these doors, we're all going to die of asphyxiation within an hour's time. If I put 50 vaporizers in this room, we're going to have a really nice steam bath, come out in 3 days starving, but with really clean pores. That's vapor. It's not smoke. The proposed legislation will only keep younger people smoking longer. The truth is we can make legislation that makes the age of tobacco usage 50. Extremely low percentage of people start smoking after the age of 18. The real question or legislation should be geared to study how children are able to obtain cigarettes at the age, in my case, of 9 or under the age of 18, let alone the proposed 21. Meanwhile, we have a complete ban on opioids, yet people are dying every day from overdoses. Is there an opioid 21 in place? Would it make any difference? Of course not. Pushing the legal age to 21 will only procure more kids to remain smoking longer, making it more difficult for them to quit or switch. Find ways to keep them from smoking in the first place. Education, parenting, and communications are key to success. Making new laws that will change nothing more than extending the time our youth remain smoking only hinders our movement and cause. I am certain this committee's intentions are noble and good. I am also certain its outcome, if passed, would only further harm our youth. More funding is needed for education, not more pointless regulation that further bloat an already overburdened government. Thank you.
Okay. Okay, is there anyone present who is not signed up to speak who would like to address the committee at this time? Being none? The next item on the agenda is the approval of minutes. You have the April 23rd, 2018 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 18-0178.
Moved by Legislator Munoz, seconded by Legislator Wilcox. I see the author of this referral is present, Legislator Harris. I'd like to give you an opportunity to address the committee at this time.
Thank you, Madam President. I appreciate the opportunity to address why I put this legislation forward. And let me start by saying thank you for the opportunity to speak to my points. And thank you to all the speakers opposed and for the legislation for coming, so I can also hear your views as well. This legislation will raise the age to purchase tobacco and tobacco products to 21. This includes e-cigarettes and vaping products. This will reduce the availability of these products, which are often marketed to our young people. And this will help young people avoid the health risks involved with tobacco. That is my intent for this legislation. Youth get their cigarettes from their social sources, which we all know, most of them who are peers between the ages of 18 to 21 years old. And we all know nowadays you see that 18-year-olds, people between the ages of 18 and 19 tend to stay in school a little bit longer now in certain circles. These health risks are well documented across all ages, but young people have long-term risks, including cognitive and behavioral impairments. Smoking is the leading preventable cause of death in the U.S. Smoking is also responsible for other diseases associated with heart disease and stroke in the U.S., which costs our country and our county thousands and billions of dollars. That has also strained our healthcare system. I often hear, actually right here in this chambers, we hear of how people are fighting for their health care. So I think that this is an opportunity for us to take a stance and try to prevent those costs from ballooning even more in the future, and so our children can have health care in the future. Other counties and municipalities have also enacted this similar legislation. I'd like to take the opportunity to name these counties: Tompkins County, Cortland County, Chattanooga County, Cattaraugus County, Sullivan County, Orange County, New York City, Suffolk County, Hempstead, North Hempstead, Albany County, and Schenectady. I also like to add that having counties like these counties take the lead on this vital public health issue will also force the state to act on the pending legislation statewide. In the past, Monroe County has passed laws ahead of the state, like the ban on texting while driving and the ban on synthetic drug sales back in 2013. I want you guys all to know that I did look at the impact that it would have on businesses, and according to information provided by SHAC, the local impact is estimated to about $226,000 annually between all retailers in the county. And I'd also like you to think about is when our county and other parts of the state changed the age for alcohol from 18 to 21, the alcohol industry was not really impacted. They were actually still doing very well, and we predict the same for the tobacco industry. In closing, I'd like to add that let's think about this legislation, that if it does fail, let's not let it fail because of technical language and process. And I think that is an opportunity for us to do something that can be proactive for our community. As long as we agree on the concept of protecting our young people for being exposed early to tobacco products, there is an opportunity for us to tweak this bill so we can all agree that we need to minimize that exposure. So I do recognize there could be an opportunity and only will be an opportunity for us to tweak the legislation before you choose to vote it down. Because I think that our youth, the youth of our city and our county, is worth that opportunity to look at the bill thoroughly in making sure that we can actually come to a compromise to protect their health. I feel very strongly about this. I like to add my personal convictions about this. I have asthma. As an adult, I've never smoked. I was exposed to secondhand smoke as a child by parents, grandparents, aunts, uncles, family members, non-family members. I mean, thankfully, New York State is a smoke-free state pretty much. In most cases, I go to the restaurant, there is no cigarette smoke. I can exit a family member's house if they don't have, I can exit a family member's house if they have cigarettes in their home. I'm thankful for the legislation that's passed where I can go on an airplane and be smoke-free. I can appreciate the fact that we have 18-year-olds that go to war and have the ability to protect our country, but at the same time, I think it's our right as legislators to protect their health and the health of our communities. So let's think about this legislation before you vote and come up with something that we can do to protect our community. And we'll close with that. Thank you for the opportunity to speak.
Thank you, Legislator Harris. I'd like to now open the floor for discussion from the Agenda Charter Committee members. Is there any discussion? Legislator Conley.
Thank you, Madam Chair. First, I'd like to thank all of the speakers that we heard from earlier this evening, and I'd like to thank Legislator Harris for her comments. This referral prompts a vote that considers much more than whether or not to support the prevention of adolescents from using tobacco or nicotine-based products. I myself do not support the use of these products by any individual of any age, but this matter that we're addressing, as it is written by my fellow legislator, poses a lot of questions and concerns that ultimately have impacted my decision on this vote. The biggest flaw in the stated intention in this legislation of minimizing exposure to teens and tweens, this law will not affect that. This local law will not prohibit the possession or use of tobacco products or e-cigarettes for 18 to 20-year-olds. 18-year-olds will still be allowed legally to possess tobacco products. While individuals under the age of 21 will not be able to purchase tobacco and nicotine products, they will be able to legally use them and possess them, as well as being able to still purchase them in bordering counties. This would prompt a slew of other issues, including potentially black market sales in Monroe County and border hopping, which shifts Monroe County taxpayer dollars to bordering localities. And this is particularly concerning to my district because I represent people who have easy access to both Ontario and Wayne counties. Neither of those counties have passed Tobacco 21 legislation. This ordinance does not do anything to curb behavior. It simply creates more government regulation, which hurts local small businesses, all while demanding increased casework from the Public Health Department and local law enforcement. That being said, I am very apprehensive about what this ordinance will be enforced, how this ordinance will be enforced, and if we have the funding and resources available to deliver any real result. I've seen numerous localities across the country implement similar ordinances that have led to failure because of a lack of stringent enforcement. What started out as an idea that looked good on paper turned out to be harmful to small businesses and insufficient in reducing the amount of minors who use tobacco or nicotine products. This was seen in Cohasset, Massachusetts, when a survey depicted a massive increase in teen smoking 1 year after they implemented the ordinance. I also want to mention that under the rules of the FDA, there are many e-cigarettes that are not considered to be a tobacco product because they market under terms that then categorize their product as an FDA-regulated drug, device, or combination product, which, as stated in this referral, are excluded. Being that e-cigarette use is more prevalent, and it's more prevalent among minors than cigarettes, this ordinance would virtually do nothing to reduce adolescent smoking. Thank you.
Is there any other discussion? Legislator Delahunty.
Thank you, Madam Chair. Thank you, Legislator Harris. This issue is a very difficult issue, I think, for this body and for all legislators. This issue is actually very personal to me. I come from a family where I had grandparents that were lifelong smokers, parents that were smokers, and thankfully eventually gave up smoking. And I'll always remember they both told me it was the hardest thing they felt they ever had to do was quitting smoking. Anyone who knows me, I'm 45 years old, and fortunately I've never smoked a cigarette in my life. I was one of those people all the way back in junior high school, college, graduate school that never smoked and was the person that was always trying to tell people the dangers of smoking and how dangerous it is to one's health and what it can do to a family. That being said, with this issue, I believe that, for us in Monroe County to try and regulate this would be a haphazard attempt at solving a problem. I do believe that this is an issue for the state, and I do believe this should be a statewide issue. I feel as though it does affect local businesses. It does pick, in a sense, which businesses can and cannot sell these products. But the issue that I really struggle with on top of this, and we've had this discussed tonight, is that in our country, as we sit, an 18-year-old can sign up, join the military, and be sent almost anywhere in the world, including a combat zone, which we have right today in Afghanistan. Come back from combat and not have the ability to go and purchase a cigar or a pack of cigarettes, I really struggle with that. If we are to change the age of entry into the military to 21, I certainly would consider looking at other options. But as we sit as a nation and as a state, right now, 18 is the age that you are considered an adult. So I think until this is looked at a broader level outside of Monroe County and either at the state or federal level, I think it's in our best interest right now to consider not moving forward on this issue and still looking, especially in terms of e-cigarettes and other alternatives out there, what the overall health effects are in the community. Thank you.
Thank you, legislators. Any other discussion? Okay, being none. Before we go to a vote, I'd like to thank all the speakers tonight. Legislator Harris, thank you, and the Agenda Charter Committee for their passion and their lively debate we've had tonight. This has been very informative. It is clear the committee has considered all factors, and this has been fully vetted. I want to briefly explain my vote before we move to a roll call vote. There are no counties that surround ours that have passed a law raising the age of tobacco to 21. Individuals will simply cross over to a neighboring county to purchase tobacco products, taking their business elsewhere to purchase not only cigarettes, but other goods that they purchase at a convenience store. Raising the age to 21 is not practical on a local level This is a concern that should be addressed at the state level. I personally do not like smoking. I've never had a cigarette, and I think that anyone that smokes shouldn't smoke. Tobacco has damaging effects to everyone who uses it, regardless of age. This is not a political issue, it's a public health issue. I have concerns that this will not reduce the number of young smokers in Monroe County, but it will add another level of bureaucracy to these businesses that the businesses in the surrounding communities do not face. At this time, I'd like to call for a roll call vote. Madam Clerk.
Mrs. Conley? No. Mr. Delahanty?
No.
Mr. Moyo?
Yes.
Mr. Wilcox?
Yes.
Chairwoman Taylor?
No.
2 to 3, the referral fails.
Okay, next item on the agenda.
Referral 18-0179.
Second.
Moved by Legislator Connolly, seconded by Legislator Delahanty. Yes, Legislator Moyo.
Through you, Madam Chair. Thank you, Madam Chairwoman. Through you to the administration. One of my questions is, or maybe my only question, what does this committee do? Who do they advise? It's through you to the administration. I'm not sure if I said that. I'm sorry.
Okay.
Through you, Madam Chair, they advise Monroe County in DES on matters regarding recycling. They meet 10 times a year, and they're comprised of a 15 board committee.
I'm sorry, I don't know if I understood that.
A 15-member committee, excuse me.
1-5 or 5-0?
1-5.
Okay, thank you.
Chair.
Through you to the administration, then, Madam Chairwoman, you said they advise the county. Is there a specific part of the county administration that they advise, or just a general advisory board?
Through you, Madam Chair, they advise Monroe County DES.
Oh, thank you. You did say that before. I apologize. I have no other questions.
Any other discussion? Being none, will the clerk, since there's no other discussion, all those in favor?
Aye.
Opposed? Item carries. Okay. Okay, are there any other matters to come before this committee tonight? Being none, the June 25th, 2018 meeting of the Agenda Charter Committee stands adjourned. The next meeting of the Agenda Charter Committee will be held on Monday, July 23rd, 2018 at 5 p.m. Thank you, everyone.